Governor Tim Walz is speaking out about the situation in several hospitals. Let's go ahead and listen in.
With COVID in the healthcare industry, but just from a little different perspective. I know that the information and the moves that we're making to pause for the next few weeks to give our state the opportunity to make sure that everyone gets the care that they need, that we're protecting those frontline workers, is hard. It's hard as you're letting this sink in. Your lives have been disrupted for the better part of 8 months, and you have another disruption to that. So I just want to be very clear that we recognize that. I see and hear you, but I'm convinced, and I think as you hear some of these folks, that in the long run, the lives we save and the disruption that happens now leads us to a better opportunity, both from a health perspective and from an economic perspective and well-being afterwards. And so when these decisions are being made, and I would also be joined today, they will not be speaking, they'll be here to answer questions, Commissioner Malcolm and Commissioner Grove, to talk about some of these changes and how they're going to be implemented and how we expect them to have an impact, a positive impact on bending this curve, which is now catastrophic. I'm speaking today, and again, I said it last night, and it pains me beyond belief to know with almost certainty that each day I'm going to stand in front of you and tell you that we've had another record number of deaths. Today it's 72. Unimaginable even a month ago, and here we are. And unfortunately, over the next several weeks, that will be more of the norm than the anomaly. So what we're fighting for is to make sure that we hit the peak of this and we start coming down. When we look at the decisions and they get asked the granular details of why here, why are you looking at this? Over the 8 months, we've come to understand, as I said last night, the longer you're in presence of other people, the longer you're in presence of other people unmasked, the longer you're in people unmasked indoors, the risk continues to go up and up and up. And once more and more people get it, that risk becomes even greater and it spreads faster. And it becomes a cascading series of dominoes that leads to what we're seeing. Stories in today's paper, over 900 staff members at the Mayo Clinic out with COVID or caring for someone with COVID. That is being replicated across our healthcare system. But I want to assure Minnesotans, when these decisions are being made, I'm surrounding myself with experts. These are not decisions that are made in a vacuum. And I can tell you they're not decisions that are pleasant for me at all. But they're decisions that once everything is weighed and courses of actions are laid out, they're in the best interest of protecting Minnesota's health, well-being. And I can tell you today, you're going to be hearing from Dr. Penny Wheeler, who's the president and CEO of Allina Healthcare. You're going to be hearing from Dr. Cindy Smith, the president and CEO of Caris Healthcare in Wilmer. And you're going to be hearing from Dr. Carolyn McLean, an emergency room physician and leadership in the Minnesota Medical Association. They're going to talk about the holistic approach. So these healthcare CEOs have to manage staffing, they have to manage supplies, they have to manage all of the things that are coming at them in real time. And then, of course, the physicians dealing with it as they see patients come in. And I hope all of you know, these are the people that I'm listening to. These are the people that are telling me what the situation is on the ground and making recommendations on the expertise that they know what it's going to take to keep their workforce up, what it's going to take to keep their emergency rooms from overflowing, what it's going to take to make sure that their parts of the state have all the care that they need. So when this, and people wonder why these things are happening, especially around this issue of a surge and the pressure on the healthcare systems, these voices, and I'm just have to tell you, this shouldn't be surprising to all of you. These are data-driven people whose job is to keep people safe. Every healthcare system in Minnesota agrees with the moves that we're making. They find no pleasure in this. They find no joy in this. They know how painful this is to families, and it's painful to them. It's painful to their workforce. It's painful to the finances that make hospitals be able to operate in an environment when we don't have COVID. It's virtually impossible to keep a healthcare system up, especially in greater Minnesota. These are the folks that do that every day. So I want to assure you, Minnesotans, that we're listening in real time. We're surrounding ourselves with experts. We're listening to that feedback and trying to craft that line, that very narrow line between doing everything possible to keep Minnesotans safe and keep our hospital from being overrun and keeping our frontline workers safe, and still allowing Minnesotans to do as many of the things as they need to do to both, one, make sure their family is economically stable, and two, to make sure that mental and physical health unrelated to COVID is being cared for. So I'd like to, at this time, introduce Dr. Penny Wheeler from Allina Healthcare to have a few words.
Thank you all, and I'm sorry that we have to be here in some respects for this, but the situation is very dire. I'm Penny Wheeler. I'm a physician by background. I'm the CEO of Allina Health, and Allina Health right now is taking care of about 1 in 4 hospitalized patients with this virus, as well as many other patients who are affected by illnesses of other types. I want to first and foremost thank all of our caregivers who are pouring their hearts out, their talents out, and their hard work out and bending over to take care of our community in every way possible. They are amazing people. If you look and walk the wards and see what they're doing every day, it's nothing short of stunning. I also want to thank Governor Walz for your leadership, Commissioner Malcolm, greatly for your leadership and the steps that you've taken to try to help us, deal with as best we can as Minnesotans with this virus. On behalf of our nurses, environmental service workers, physical therapists, pulmonary therapists, EMS providers, physicians, and all of our care supports, we thank you for the actions you've taken. And we implore Minnesotans to help us. There is nothing worse as a care provider than to think that you can't adequately care for somebody in front of you who needs your services. And we're getting to that point where, because of the community spread, which is going up with that exponential curve, because it's all sickening some of our healthcare providers, including those who have been exposed or are positive for the virus. We, like Mayo, you mentioned, Governor, has 900 out. We have over 800 people out at Allina, and there's no surge of other providers available to take care. We need you. We need you to take care for us. If I could get down on my knees and you could still see me above the podium, I would do so. We need your help terribly. These measures that the governor and others have take place, all of the healthcare systems fully are supportive of those measures. We don't take it lightly. We understand that we're all missing connections. We all miss activities. We all miss those things. And we have to take a hit for the time being to be able to care for one another, to be able to do this most successfully. We understand it. We understand and know fatigue. We know it, and we know you're feeling it both personally and professionally and with other life stresses. We know that. But we implore you to help us. Please, please take all the precautions you can possibly take to make sure that we keep you healthy. You help keep our healthcare workers healthy so they can care for you, your neighbors, and your loved ones. On behalf of all of us, I implore you to do so. I'll say one other thing. It's not forever. We know a whole lot more about this disease now than we ever did before. And we also have promising things on the offing with the vaccine coming forward. So it's not a forever thing. It looks different now than it did several months ago. There's some promises out here. We're just needing a bridge so that we don't become completely overwhelmed and unable to take care of the community. And we're getting perilously close to being there right now. So thank you for all you do. On behalf of a lifelong Minnesotan and a triple gopher, undergraduate medical school and residency, I can say that I know what this state is capable of, and I know what you can do. Thank you in advance for your help to help us care for you. Thank you.
Hi, everyone. Good afternoon. I'm Dr. Cindy Firkensmith, co-CEO of Caris Health in Wilmer, Minnesota. I want to thank as well Governor Walz and Commissioner Malcolm. Your leadership has been tireless and heroic during this unprecedented time. And speaking for my colleagues at CentraCare and Caris Health, we're incredibly grateful for all you're doing. We'll get through it. Thank you. Caris Health Wilmer is 100 miles west of the Twin Cities and is a member of the CentraCare family. CentraCare and Caris is a community of 12,000 dedicated staff, and we serve patients through West Central and Southwest Minnesota. My goal today is to share awareness about the developing plans as we face the challenges of COVID-19 in rural Minnesota. We're caring for a rapidly increasing number of COVID-infected patients in our communities. We're working to keep our hospitals and long-term care facilities out of crisis state. But with forecasted projections and without extreme action, it will be in crisis all too soon. In the past 7 days, CentraCare has performed well over 10,000 COVID tests with a positive rate averaging about 22%. In Wilmer, in the last few days alone, our positive test rate has been about 30%. So that means about 1 in 3 people that we've tested has been positive. So conceivably 1 in 3 people in our community could potentially be positive. At Rice Hospital today, 42% of our inpatients have COVID-19. Our goal as a system is always to have hospital beds available for emergency patients, and this is especially true for CentraCare St. Cloud Hospital, as it plays a critical role as a regional tertiary care center. CentraCare is there if you have a stroke, or if you have a heart attack, or if you have a bad car accident, and we need it to be available for the patients in rural Minnesota. But because of a large community number of COVID patients, we've found ourselves in dire straits. Wilmer is serving as a southern hub of CentraCare in an effort to keep patients that are critically ill away from CentraCare Hospital. So our goal is to be open for these patients. In the last 11 days, the first 11 days of November, we've been on divert for 10 times. What that means is that 10 times in those 11 days, we have not been able to accept patients into our hospital. This is a historically unprecedented number. When our hospital's on divert, it means that we can't hospitalize a patient with COVID, but it also means we can't hospitalize a patient that has that heart attack or has that stroke or has something else that they need to be hospitalized for. And we have to look for a bed elsewhere. Care for that patient is delayed. Patients can be hurt. In a worst case scenario, someone might die. This is a situation that hospitals across Minnesota are facing every day and working desperately to avoid. As a result, we're implementing a wide variety of things to kind of offload these patients and make sure that we can take care of critically ill patients. We're limiting the number of surgical cases in St. Cloud and Rice Memorial Hospital. And remember, these are not just elective cases. When we're delaying surgeries, these are cases that need to be cared for as well. So we're trying to balance the need for surgeries for cancer prevention or cancer detection. What needs to be done today? What can be delayed a few days? What can be delayed a couple months versus a patient that might need to be hospitalized right today? It's a constant balancing act. It's a huge challenge. It's horrible for physicians to have to make these decisions, and it's horrible for patients to have to wait for their care. We're providing alternative sites for surgical cases in coordination with our regional facilities. We're implementing processes to level load patients throughout our health system. Starting Monday, November 23rd, CentraCare SOC Center will be available for COVID-positive patients that don't require ventilation or high-volume oxygen, but still need hospitalization. Our small critical access hospital in SOC Center will be a COVID-only hospital. CentraCare Melrose and CentraCare Long Prairie will take non-COVID patients from throughout our region and take OB and surgical patients that would ordinarily go to SOC Center. CentraCare Long Prairie will also increase its capacity for swing beds and transitional care throughout the region. All of these emergency departments will remain open for our patients, but we'll be transferring those patients to other hospitals depending on what their needs are. CentraCare Monticello is in the process of increasing its capacity to care for COVID-19 patients, and will have 14 additional beds on Monday. They'll continue to care for other patients as best they can. Caris Health and Rice Memorial Hospital will continue to provide acute and medical care for COVID patients and non-COVID patients. And we'll work with all our partners in Redwood Falls, CentraCare Painesville, Meeker Memorial Hospital, Swift County Benson, and critical access hospitals around us to take the best care of patients that we can. The challenges in caring for COVID patients revolve around stuff, space, and staff. In the spring, we were challenged building supplies of stuff, ventilators, personal protective equipment, testing supplies, and we're pretty good with that stuff now, though our procurement staff continues to look at those supplies daily. Space is not an issue for us. Our challenge is staff. Dr. Wheeler already talked about that. Recently, we've had more than 10% of our staff out. That's 1,200 people for us in rural Minnesota. It's incredibly hard to get health professionals in rural Minnesota, and we've got 1,200 people out, either with COVID, on quarantine, or taking care of family members who are ill. We don't have anybody to replace those people. We could have piles of PPE and hundreds of beds, and none of that matters if we don't have the people to care for our patients. The physicians, nurses, respiratory therapists, nursing assistants, environmental services professionals, and all the people working on the front lines have been doing that for 9 months now. They're sick of this virus. They're sick of it just like everybody else. And beyond that, they're exhausted. And we don't have anybody to replace them. There's no calling New York. There's no calling Texas. There's no calling the Twin Cities. There's no calling anywhere to get help. Our hospitals, emergency rooms, and the places where our staff take care of patients are safe. Our data tells us quite clearly that if our staff gets exposures, it's not in these places, and our patients aren't getting sick there either. People are wearing the right PPE and they're protected. Because the virus is so widespread in our communities, they're catching it just like everyone else. In the community, at home, when they let their guard down, when they take off their mask to eat, when they can't socially distance. Not only are our staff exhausted, but they're also frustrated and disheartened by the number of people who aren't doing what they must do to stop this virus from spreading. It's heartbreaking for healthcare workers to finish an exhausting workday only to stop at the grocery store and see people not wearing a mask. Don't call health workers heroes if you can't put a piece of cloth or paper over your face to protect them. The mask is protective, but a healthcare worker, to us, to healthcare workers, it shows us that you care. My colleagues are asking me to ask you to help them. We are begging the people of Minnesota to mask up, to stay home, to keep your distance, to wash your hands, because healthcare workers are doing everything that we can, and we can't do it alone. I saw a Facebook meme that resonated with me that helped me visualize this pandemic in a different way. Imagine being a firefighter. And while the rest of society goes out and starts thousands of fires every day, you're fighting them. And you ask people to please practice fire safety, but they refuse. And they tell you, as you've been exhaustively fighting them every day, that those fires are just a hoax. That most people survive the fires, so they're not a really big deal anyway. And they've got a right to start those fires. And that's what it feels like to work in healthcare right now. We're begging you, please, wear a mask, socially distance, wash your hands, protect yourself so we can protect you. Help us help you. Next, I'd like to introduce Dr. Carolyn McLean, I apologize, a good friend, an emergency physician, and board secretary and treasurer of the Minnesota Medical Association.
So hello, everyone. I'm Dr. Carolyn McLean, and I'm an emergency physician, and I'm speaking on behalf of the Minnesota Medical Association. And we would like to thank Governor Walz for putting in the virus mitigation measures. And I personally would like to thank him as a frontline emergency physician. And I think Dr. Wheeler and Dr. Smith did a great job about talking about the challenges. So I might just focus on what it feels like. As an emergency physician right now, this has been one of the hardest times in my life. I've worked in Haiti after the earthquake, and you could go home, and this is my home, and I am watching people die. And that is hard, and it's been going on for a long time. I think that one of the hardest pieces that we see is not having family with family members when they're critically ill. And there's nothing harder than seeing people praying in the parking lot when their family member's sick and they can't be with them. And as a nurse or as a physician, you take that home with them because you feel like you have to love them a little bit more because they don't have their family with them. And now when we're having staffing shortages because so many of our nurses and doctors and techs are getting COVID, that means we have to do more shifts like that. And it gets tiring. And I think when I'm just going to tell you about a patient I saw a week and a half ago, and he was in his 90s, and he came in with shortness of breath, and he was critically ill. And I knew I had to walk back in there and tell him his COVID test was positive. And when you do that to someone in their 90s, they know what that means. So he said to me, he said, Dr. McLean, I don't think I've been this scared since I fought in Korea. And I thought, God, this guy has done so much for Minnesota and this country. What can I do for him? And that's why I'm here today. He is now a statistic, a death statistic, but I'm here today to ask everyone to do everything they can to try to slow the spread of this virus so we can take care of your family members like they're our own.
Thank you, Dr. McLean, Dr. Smith, and Dr. Wheeler. And I can tell you, Minnesota, and to members of the press here, I do not take lightly asking these physicians to come here. One, they're incredibly busy in the middle of a health crisis unseen. And two is, although I wished it wasn't so, it's a reality. Anytime we talk about this, it becomes politically charged and it becomes very divisive. And one of the things is I want to make sure to shield the folks who are doing this work, who come here apolitically as experts in the medical field, just trying to state what they're seeing and what needs to be done. So I want to be clear. They're not here to support my position. I'm here to support theirs. I'm here to ask Minnesotans to support their position. And again, doing the things that were asked, whether it be masking or social distancing, some of the mitigation issues, don't do them because I asked you. Don't do them because I made an executive order. If you have anger about how the system's working, please focus that directly on me, but acknowledge the reality. They are telling you an authentic lived experience that is playing out across this state and across this nation. And we do have the power to do something about it. We are not hopeless here. This is not inevitable. It's not, oh, shucks, just let it go and it'll work its way out. Or to get into the point, and I get it, the granular details. I wished we were perfect in our orders, but I get people, well, what happens if I'm doing this at 11:58 tomorrow night? What are you going to do? Probably not a damn thing, because I don't want to be out there having to do that. If it's not the right thing to protect healthcare workers, don't do it. That's all we're asking. So I would ask all of you in Minnesota again, and just, I cannot convey enough. This is incredibly painful. We made calls again today to our federal delegation. We're speaking with the highest levels, both in the House, in the Senate, and to both the outgoing and the incoming administration to move aid as quickly as they can. If it is not a perfect package or a big one, I don't care. Move the package that helps small businesses and individuals so that they can make good decisions. Don't put our neighbors in a position that they follow the healthcare guidance and protect those frontline workers, yet they put themselves at risk of losing their house or not being able to pay the bills. It's simply unconscionable and immoral right now that the United States Senate and Congress went home on a vacation when they could have moved this piece of legislation. So once again, Minnesota, I acknowledge this is painful. It is damaging economically. It's damaging periphery on health and mental health, but we have to triage the situation that's upon us now. And that situation is an overwhelming healthcare system and things that we know can make that a little bit better. So I want to say thank you to the folks who are here, and I will open it up for any questions from any of us. Yeah, go ahead, Dave.
I have a friend whose husband goes out and socializes a little. He wants to have 2 friends over for Thanksgiving. He's insistent.
I don't know what his name is, Mr. Husband, but I'm going to talk directly to him. Please don't. Because you may think that whoever you're going to eat Thanksgiving dinner with is not infected with COVID, but whether they have symptoms or not, the chances right now are very high that they carry that virus. And so someone in that room may infect someone else in that room. And then they go out in public, infect someone else, and that person infects another 3 or 4 people, and on it goes. And a lot of those people are going to end up sick. Some of them are going to end up in the hospital, and some of them are going to end up dying. And that's what's overrunning our hospital system right now. So we understand that it's hard not to celebrate Thanksgiving with the people you love. We all know that. We don't get to either. The people working in the hospital not only don't get to celebrate Thanksgiving with the people they love, they're going to be watching people die that day. And they don't want to watch you die at Christmas. So please don't. Just this year, please don't.
They said that New York Rice Memorial Hospital is potentially available to serve or treat ICU patients. Is it not already? And how can it suddenly be ready? I mean, like I say, staff doesn't grow on trees. How can you suddenly be ready to take care of ICU patients?
We are always ready to take care of ICU patients. When a hospital is on divert, you're on divert for an hour, you're on divert for 2 hours, you're on divert for 4 hours. And in our system right now, we have the ability to transfer patients. So we might have a hospital right now that's full, but we are constantly, and I can't say that they're full right this minute because I'm not out there. It varies from hour to hour, literally. So if we have a patient that's in our hospital that we think is well enough that we could transfer to one of our partner hospitals to be cared for at a different level of care, we will do that in order to open a bed for someone to come in at an ICU level. So we have the ability to shift staff. We have the ability to shift patients. And that's what we're doing. It's you guys can speak to it. It's musical hospital beds. We're doing it in the entire state, finding the best place to take care of patients so we have room to take care of the next one.
You mentioned that 10 of 11 days when you're on divert status.
Yes.
What does that look like from there? Where are they diverted to? How far do they have to go? How does that maybe present a challenge to caring for them or their health?
Yeah, it's awful. When the emergency room is always open. So the divert status means that a patient that comes into our emergency room might not be able to be hospitalized in our hospital, or if one of our critical access hospitals is calling and needs to transfer a patient to our hospital for a ventilator, we might not have the ability at that moment in time to take that patient. So we work with that hospital to find a place where that patient can go. Alina, for example, or Centricare, or Health Partners, some other hospital in the Twin Cities or throughout the state where we can find a bed that's open for that patient. The issue with that is, number one, there's a delay, right? Because you want that patient to get the care as close to home as possible because it's more efficient, it's better for the patient, it's faster. If you've got to look around the hospital or transfer a patient further away, it delays the care, potentially worsens the outcome. Good question. It varies. You know, we haven't had to send patients outside the state yet, but we've certainly had to send them throughout the state. From our corner to Mayo, from Mayo up, certainly to the Twin Cities and back. The patients have been shifted all over the state throughout the last few weeks.
Restrictions coming too late. We hear you talking about thousands of healthcare workers across the state who aren't able to work right now.
Yeah, so are these measures coming too late? Yes, I mean, it's exponential spread, but if, you know, the next best time to start is now, and they can make a difference. We can make a difference if we start now. So just as we had Kelly, one of our ICU nurses up here the other day, and she said that, you know, we're not the front line. You out there are the front line. And we need your help. So these measures, well, be it we wish, and first of all, thank you, Minnesota. You did give us time to get that space and the stuff. Now you need to help us with the staff. And that is what we really need right now. So although we wish we weren't in this situation, none of us wish we had to make choices or decisions like this. but we need it, and we need these now to bridge us to a day where we start to see a little bit of light coming with more effective therapeutics and vaccines that are looking quite promising. We just need it now. We don't need it forever. So I implore you to do so.
Question for you on that. With these restrictions starting up tomorrow, how long of a lag time until you see that reflected in the hospital setting, the results of that lessening the load?
Well, it looks like, when we're watching the case counts really closely in our hospital is how we're projecting things, because it seems as though that our peak counts come about 12 to 14 days after the peak case counts come. And all you have to do is say the number 72 right now. 72 Minnesotans today, and almost 8,000 more cases. So we're not seeing that go down, which means that ours are still going to be bumping up for the next 2 weeks at least. And it's why we need these measures now to slow that. When we start to see us coming down the curve of those case counts, then we'll feel like we may have the capacity to care. And I will say one more thing about shifting patients around, as Dr. Smith was talking about. This state and the collaboration between healthcare systems, we meet once and several times often a week, and we have set up a critical care coordination center so we can do this most effectively between systems. So I would also say that we're pulling on everything possible to try to make sure we extend our collective capacity for the citizens of Minnesota, but it's not going to be enough unless each one of us that everyday heroes are actually out there. You can be one yourself if you just follow the guidelines, please.
Wheeler, are you taking in, we've been surrounded by states with higher rates. We're kind of following them over the roller coaster. Have you been taking in a lot of patients from out of state, and is that going to have to change now?
We all care for people in some of this. We have seen an influx for some of our border towns, because all of us have rural settings out there as well. So we have seen some of those. I can't tell you any specifics about what we've taken in from other states. We serve some other states too. We have, for example, a hospital in Wisconsin, Western Wisconsin.
Well, I'm going to ask a question of you and also Dr. Firkensmith. 800 workers out, 1,200. And with the numbers going up at the rate they are going up, and the number of healthcare workers you have going up that are staying sick, how long can you sustain this? I mean, what are the talks like behind the scenes? How many days before it becomes untenable?
There are so many, certainly the availability of our workers and the workers who are out on quarantine, sick, or taking care of their children because their childcare workers are sick, is one of the most important factors out there. But there are other factors too, including the concentration of disease in your community, how many you're able to staff, how many support people you can pull into those teams to help them stretch themselves. So there's a lot of other factors involved. How many critically ill come in? Remember, just as Dr. Smith said, we're taking care of people who are critically ill with things other than COVID too. So it also depends on what we're seeing in terms of, automobile accidents, cancer diagnosis, strokes, heart attacks, all of those things as well. So it's multifactorial. And that's why it's so hard to say, oh, we're at the edge at this point, because all of these factors factor in. I can tell you that we're up here today because we are perilously close to not being able to even collectively, with all of our best efforts and innovative care models, take care of everybody that we need to take care of in this state.
Governor, can I ask a question?
If I can just hear from
Go ahead.
Dr. Minnesota, and also, Dr. Can you clarify on the 10 days that you've not been able to send patients, was that just at Rice Hospital, or is that system-wide?
I spoke specifically to Rice for that 10 days, and it's not a full 24 hours over that 10 days. Remember, on divert means it might be an hour now, it might be 2 hours, it might be 4 hours. We get email or texts that tell us we're on, we're off, we're on, we're off. So it comes and goes. As to the question of when will we run out of workers? Don't know. I don't know. And that is why we're here today. What we're asking our workers to do is pick up extra shifts, work days they're not used to. We have a labor pool where people are filling in where they haven't filled in before. We certainly still have there are certain areas that people can't fill in. Obviously, I'm a dermatologist. I could never work as a critical care nurse. That'd be totally ridiculous. But maybe there are things that people can help do so that other people who are critical care nurses can do more critical care nursing. So we're looking at innovative ways to get help for the frontline people.
Are you seeing a change? You mentioned working exhaustively and then going to the grocery store to see people without masks. Is that changing where you are, or is it still the same? And what do you say to those people?
I'm here to say it to people. Please wear a mask. Is it changing? A little, I think. I think maybe some people are finally getting it. Online, I've had people comment that, yeah, I finally get it. I believe you now. And then I have people say, I don't believe you. You're a liar. It's a hoax. What do you say to that? I had a patient. I have been a physician for 30 years. I do a lot of skin cancer surgery, and I have a patient that said to me for 30 years, I'll only come to you because you're the best doctor and I only trust you. But he said to me recently, I don't believe in COVID. It's all a hoax. And I said, I'm telling you that it's not. How come you've only come to me for 30 years and you believe everything I say, but you don't believe me when I say this? And I don't know why. Help me understand that.
Governor, if I may ask, this might be redundant. I had some tech issues with the press briefing last night, but did we waste a week with the interim measures that were done last week? This was kind of a foreseeable exponential growth, and I'm wondering why we bothered with this.
Yeah.
We ended up having to do.
No, it's a fair question, is if we should have moved last week to these measures. The one thing is that I remind folks of several things. First is the growth that we're seeing has not been seen during this pandemic, nor the level anyplace on the planet. So looking at what's been there was no model to model that. But I've said all along on this, there's other considerations that go into this. And one of those is trying to get the social psychological compliance of this. I want to just be very clear, and you take this with what you do with it. You're the professional journalists who are here to do this. Before I'd finished speaking, elected officials were saying, don't listen to this is wrong. Don't do it, the governor's wrong. Now, we get into this thing, well, the governor's got a political point. He said this, and they said this. No, I'm standing with every single medical institution in the state. If those elected representatives want to hold their press conference and have them here, they should do so, because I'm frustrated by this. I'm frustrated by that it takes the time to do this. So I would say in answer to that question, certainly, like so many things with COVID, in retrospect, should we have gone and moved that quickly? Perhaps. Is that a reality when you're in the time of what it takes to do it and to try and get the buy-in? Because there also are considerations here, real considerations of the peripheral pain that is caused by this. And I do not minimize the businesses who are going to go out of business potentially by this. And we're trying to get them to try and help. And we're simultaneously trying to see what is, and we were doing this all last week, what is the potential that we get a federal relief bill that allows us to do that? To be very clear, to make the move that we made here without the financial supports is really hard, and it's certainly not the right way to go. Earlier in this pandemic, that's the reason why the federal government in every single nation on earth moved a support plan that went hand in hand with pandemic mitigations. So yes, did it get another week? Potentially, but that's not the reality of the world we live in, the potential to be able to get coalitions to get it done. And then I think continuing to try and put pressure on that support. But I would think you could have at least let me finish last night before the politics. This is what they're hearing. This is what and this is, I'll own this. I've got to figure out a way to separate that. If I'm teaching my classes, I always tell you, and it's the truth, I teach a lesson and the majority of students don't do well on a snap, test to see where they're at. That doesn't mean the students had something wrong. It means it was in the lesson, how we're doing it. So I'm always trying to reevaluate, is there a better way I can deliver this message? And I'm here today and have been trying this week, again, as you heard this, Don't do it because I'm asking you to do it. Don't do it because there's an EO. Do it because it's the right thing to do, and the data and the experts behind this show that. So if you're out there questioning it's the right thing to do, if you have been a healthcare CEO or an emergency room physician, then you've got a little bit of expertise on that. But it's a broader issue across the entire state and across every industry to try and get that buy-in. So
for Commissioner Malcolm, if folks don't take seriously some of the advice we're hearing today, they want to go get tested before Thanksgiving and then go ahead with the Thanksgiving dinner. Can they expect changes to testing capacity or processing time next week? Do you anticipate more folks are going to try to get in and get tested?
I'm really sorry. Could you say that just a little louder? I have been hearing loss.
I'm wondering if you anticipate any changes next week in terms of testing capacity or processing time as more folks try to get tested?
Everyone's trying to find here.
Well, thank you for that question. I mean, certainly we understand people's desire to get tested and then feel like, well, then I'm safe. And we appreciate that people are more interested in testing. We've built up a lot of testing capacity and we continue to do so. And the demand that we're seeing at the semi-permanent saliva testing sites that are around the state now is really quite amazing. So we're glad that people are seeking testing. Particularly with respect to the Thanksgiving plans, though, that I'm sorry to say it, but that is not that doesn't take away all of the other risks that we know are there, unless every single person is not only tested, but has quarantined from the time they get tested until the time they gather. That risk is still there. There's this real tendency, and I get it, desire to say, well, I got a test and therefore I'm fine. Tomorrow I might not be fine. So we anticipate that people will continue to get tested because it's important for all of us to get tested for sure when we have symptoms. We're encouraging more people to get tested who are in the critical demographic of those younger ages. And we've talked about that. We know that there is a significant number of people who are infectious who have no symptoms or who have such mild symptoms they don't attribute that to COVID. So we are wanting people to get tested, but with respect to, does that give you a free pass for Thanksgiving? I'm afraid it doesn't.
The folks in greater Minnesota who waited 5 or 6 days to hear back about their test results, do you know why some of those testing facilities take a little longer? Is it additional testing going on, other reasons?
The issue of slow turnaround time is a concern. It remains a concern, and partly that's driven by what we're seeing nationwide. 168,000 cases in the United States just yesterday. So laboratories like Mayo, the other national reference laboratories, are very, very busy and having trouble keeping the turnaround time as low as they want. It's one of the reasons we brought the saliva lab here to Minnesota, so that we could have a fast turnaround time with that testing methodology, and we're still able to turn things around generally in 48 hours or so with the saliva tests. So we totally get it that waiting is not the optimal thing. And it's so important that after people get a test, as frustrating as it is to wait for the results, you have to act as if you're probably positive while you're waiting for those test results to come back. We'll do everything we can. Our healthcare partners are doing everything they can to add capacity and speed up processing, but that is just a fact with the volumes that we're seeing around the country, that those national labs in particular are pretty backed up.
Granted, it's never too late to start mitigation measures, but is it too late to bother with contact tracing? I mean, you can't possibly keep up. The time to just tell everyone to bunker down rather than to try and trace where their infections are coming from. Are we going to give that up soon? Are we able to?
Great question, Jeremy. It's about contact tracing, and the time when contact tracing works the best is when you're able to really focus on hotspots and identify cases and identify contacts quickly and isolate and quarantine them. But to borrow Dr. Smith's analogy and image of the forest fires, it's really hard to even find hotspots in the middle of a raging forest fire. So we are actually having a conversation about that as we speak. How can we adjust our contact tracing protocols to make sure that we're putting our resources into where they have the biggest impact? And it is the case that the value of the information coming out of contact tracing gets to be less and less with this degree of community spread, where people have no idea where they might have gotten this or who they might have exposed. So we're taking a look at that right now. I would say we want to the extent that technique is not working, we want to supplement it with other things. And we're talking about a variety of ways to do that.
Yeah, I would just close a little bit and ask that. I think the question is really good about the timing and all that. Yes, we've lost 8 months in this nation of being behind. And once it became clear that the states were going to have to develop this, and I've said from the beginning, I'll continue to say it, the responsibility lies with me to make those decisions. But I'd also like to say is all of us, and that includes my staff and these folks that are here and we as Minnesotans, we're sharing in your stress. It's okay to not be okay. And I think about this, and I'll just say this just candidly. I have relied on few people in my life the way I've relied on Jan Malcolm during all of this. And I think about this for Minnesotans. And Jan, I hope I'm not overstepping here. During this pandemic, Commissioner Malcolm's lost a spouse and a mother. And amongst all that, she said something that she keeps reminding us of. Her epidemiologist, this is not about numbers, it's about people. And she talks about the whiteboard that the epidemiologists have, that they list the names. They say the names every day. That board is totally full now. It was easy in the beginning, and they would tell me, and I would remember the names and think about them. I can't remember all 3,000. I can't remember the 72 today, but it doesn't mean they're faceless, and it doesn't mean that they didn't mean a lot to their families. And so Jan reminds me of this often, that we deal with numbers, we deal with viruses, we deal with systems, but that's not what we deal with. We deal with people and decide what type of state are we and what matters to us. Tonight across the state of Minnesota, from the Split Rock Lighthouse to the I-35W bridge, our landmarks across Minnesota will be lit up purple in remembrance of those 3,000 plus Minnesotans who've lost their lives. And if I could ask anything today, Minnesotans, of the mask up and the social distance, and try and do it, not for me, but for your loved ones, take a moment, see that purple tonight, take a moment to think about it, and recognize as you're thinking about what Thanksgiving will be like, all of us know what it's like to lose a loved one. It doesn't ever get that much easier. It just changed a little bit. These emotions are raw for the families of 3,000 Minnesotans, not to mention the families who folks are in intensive care right now and they don't know what will happen. So this has been an unprecedented battle. It has pitted us against ourselves in a way that I'll go to my grave not understanding why. The battle here is with the virus. The battle here is believing the scientists and public health experts. The battle is having compassion for businesses who are doing what's right while they may end up losing that business. All of those things should have brought us closer together rather than further apart. And I would just ask in Minnesota, it's not too late to change that. It is not too late to change the narrative around this. It is not too late with that light at the end of the tunnel and a potential vaccine to turn this thing around. So stay safe, Minnesota, and mask up. Thank you all. I'm grateful.